welcome back. Summer series wouldn't be complete if you didn't take care of the, well, your soul. And we're talking about your feet, specifically. Mark Bradley's with us, Brantford Podiatry Associates. Thanks for coming in.
Very nice to be here to save your soul.
I'm going to do something different. You know, generally the running gag, your wife Marilyn especially, is about you and I staying on topic. So here's something new. What are we going to talk about today, Mark?
We're going to talk about you.
Oh, okay.
Yeah, we're going to talk about you. It's funny in our practice. We get a lot of female visitors, and they'll describe their problem. It started about a week ago. And for men, it usually they're under duress. They've been brought by their wife, or it's been a year since the problem started. In your case, we've been listening to your foot problems for a very long time. So finally, I convinced you to come in and see us.
Well, I got to tell you, I don't know if it's a guy thing, but you right away assume, oh, I must have twisted my ankle. I must have done this. I did that. I mean, I know, you know, it can't be anything long-lasting. It'll be gone in 2 weeks.
As is the case with a lot of problems for male and female. And yeah, it would be nice if things would just go away on their own, but when they keep reoccurring, like your heel pain has been for a very long time, there's obviously a little more to it than that. You can't keep punishing yourself over and over again.
Do you have trouble, and I guess if I use your little foot thing here, do you have trouble making somebody understand that some problem there is going to give pain there? Very
much so. Or some problem in your knee or your leg can result in pains further down or pains further up. And a lot of the time it's very difficult, because I believe it's very important that our patients should understand where their problem originated from in order for me to get them to say, okay, you know what, I am going to change my lifestyle, I am going to change my footwear, or I am going to buy into some sort of treatment plan and commit themselves to it. Okay, let's get to it then. So what are you going to explain? So in your case, you had a little heel problem, right, and it's been going on for a very long time, and that heel problem is something called plantar fasciitis, which is where you've consistently been causing a little tear to happen on this very tough fibrous band in the bottom of your foot. So what we did was we brought you in, had a little look at you in our office, had a look at your bone structure, had a look at you standing. We even got some x-rays ordered so we could see exactly what you were like under the surface, because everybody wants to know that. Yeah, and you did a lot of listening. And I want to explain that. You did a lot of listening because, as you and I both know, one of the main problems where I was having pain was if I was standing up, broadcasting hockey as I do, standing was tougher than walking in a lot of cases. And sometimes getting out of bed was difficult after 7-8 hours of whatever, of just lying there, and then the foot hit the floor, and that was worse. And that gave you what the roadmap to get an understanding. And especially with this condition, it seems incredibly unfair that it should be most painful after you've rested. Right. I mean, like, that's when you should feel your best. Right. But typically when you get off your foot, that's when the inflammation and the swelling kicks in and the pain really occurs. And you mentioned earlier, it's a key point, despite the fact I seem to do nothing but talk every time I come in to visit you. In the office, if we don't listen to our clients, we're going to miss an awful lot of information. Not just, you know, physical, habitual stuff, but stuff to do with their systemic health, because that plays a huge factor on us being able to actually diagnose the problem correctly and be able to do something about it. And you looked at, you got that little red spot kind of highlighted there, and you talked about little tears happening. Yeah. I guess the average person doesn't understand. Sprain an ankle, you've done some tearing. Yeah, and it sounds terribly horrible. It should rip right off the bone. And it's not. Most tendons, ligaments, everything's made up of very small little fibers. And when they get damaged, we release chemical messengers, little prostaglandins, and they say, you know, send help. And help comes in the form of increased blood supply and increased blood flow through the area. And that causes the tissue to swell and distend, and all the little pressure receptors then start firing off. So our job, in order to treat that, we need to know why you're tearing that and what it is in your foot structure that's causing that. This is kind of a mystery in reverse, because we're going to go to break in just a sec. We now know you found out what the problem is. So when we come back, we're going to find out, you know, after the listening, how you were able to find out exactly where the problem was. Absolutely, and what other problems are lurking. Okay, so we have pain in the heel. We have you listening to when the pain's the worst or what's exacerbating it, and then the next step in diagnosis is what? Well, basically, we had a little look at your x-rays. We had a look at you stand. Now we have the ability to actually have a look at you walk. Right. And previously, we want this tool to be able to describe things to you, to demonstrate things to you. It's actually made us much, much better at becoming diagnosticians.
You said stand. Can you literally kind of, can people be that exaggerated? You sit there and go, wow.
Oh, absolutely.
Really?
Yeah, very much so. And even in your case, you can see your foot tends to roll in a little bit and pronate a little bit, but seeing you actually walk is much more telling.
So are we ready for my ugly feet here? So we can
okay. So this is, you've seen this obviously in the office. The imagery was a little bit clearer. If we can let that roll now. So again, we have the ability to slow it down and show you exactly what's happening. And because of the curvature in your leg, we could see your foot strike on the outside and roll in. Normally the foot's supposed to recover from that, and you're supposed to regain that nice arch structure. In your case, unfortunately, you stay rolled in like that. Again, we've got 4 different views that we can view you from and basically demonstrate this to the patient. And most folks have never seen this kind of thing before. As we go on now, we'll show you the 4 different views. It gives you a very, very clear understanding. For some people, this is impossible to fully grasp what's occurring.
It sounds almost like 3D.
It is a little bit, and it is an incredibly difficult thing to try and describe to someone, especially in a sort of normal, the amount of time we normally have available in the clinic, it becomes difficult. We also have the ability to draw little lines on there to really demonstrate how badly you're functioning. The important thing here, though, is we can tie this in with all the other information. For example, we also had some x-rays of your foot, and we're able to look and see where your foot's actually twisting and rolling in through the midsection. Fortunately, at the moment, there's been no damage done to the bone structure, to the callus, or to the actual joint surfaces, but you can actually see, again, the little growths of bone that are taking place, and again, underneath the heel, where the little bony spurs are developing. So it helps us, narrow down the diagnosis and get even more precise in your case.
So now it's the wonderful world of orthotics, which are going to improve the biomechanics out of the foot hitting the ground?
Exactly. The whole purpose of the orthotic design is to support you as close to your normal position as possible. I can't change you. All I can do is enable your muscles to function better and more effectively, and we try and do that in conjunction with some changes in some cases with your footwear. Sometimes, especially, this is an example, this is the latest device for my son that we just got. He's got some pretty awful feet. They roll in very, very dramatically. So in his case, we have a very, very controlling device that cups his heel. And again, it really stabilizes him. And as he continues to grow over the next 8-9 years, he's actually got a chance to recover from this situation and end up with a much healthier bone structure, and hopefully not actually have to deal with this kind of thing throughout the rest of his life.
Great point. This doesn't have to always be that way.
No. Unfortunately, when you get to your age and my age, and our bone structure is basically set at this point, we're trying to prevent further damage from happening with you. I'm not going to be able to cure you to the point where you'll be able to function barefoot and gallop around the place. You're still going to need to consider good footwear and orthotic devices and things like that to help maintain you through the course of your life.
Okay, so the end result is just there's a period of adjustment. Other muscles are going to have to react to the improved feet, shall we say, and go on from there?
I mean, at this point, your muscles are completely overwhelmed, and that's why the plantar fascia that we talked about earlier is playing more of a role than it was originally designed for. If we can get those muscles back on board and functioning much better, this will go back to its relaxed state and come out to play every so often.
Before we let you get away for the summer, we were just looking at some x-rays, I guess, but before we go away to break, it's not old age, it's not necessarily your shoes, it's not if you're having some kind of pain, talk to somebody.
Absolutely, and in a lot of cases, it can be very, very simple.
Have a great summer, and thanks for this today.
Thank you very much, and you have a good summer too.
Dr. Mark Bradley, Brantford Podiatry Associates. Hey, our favorite word, our 4-letter word, food, coming up next, right here. We're inside Brant.